communication, 911 communication centers in Craven County, and they have on in the county itself that have been operated for a long time now. And over those years, there's been a couple of attempts at trying to combine efforts, those three centers into one, or possibly some combination of three. But for one reason or another, it's failed. We have recently been advised that the state, the North Carolina 911 Board, is considering some new standards for communication centers across the state that are going to dramatically affect cities and counties that operate communication centers. Namely, the new standards that are under consideration will require increased funding for additional staff, for training, as well as equipment. Also, it's expected that probably within the next year or two, there will be some new requirements too for a service that some counties and cities already provide, but we do not. In Craven County, it's known as emergency medical dispatch. Emergency medical dispatch basically is that in the event there's a call for emergency services, namely that for, I guess, a life-threatening situation, namely needing rescue squad emergency medical services, then the dispatcher will be required to stay in communication with that person who called on that until EMS service arrives, so that they can give instructions on whatever may be necessary to maintain someone's life until someone is actually on the scene. Is that correct, Stan? Basically correct. We know that some of the other things in terms of the staffing requirements that they are discussing, none of this has been made formal yet, but we're expecting it to be within the next 12 months or so. The staffing right now, they're going to require that there be minimum of 2 dispatchers per shift around the clock. And with that, then there's also going to be a requirement there must be a supervisor. So that means there will be not only 2, but there will be a 3rd person now. And then there are some other things as well. Anyway, long story short, all of us are going to be facing these new standards, and they're going to cost a lot more money. Because of that, the manager in Havelock and Newbern and I have had some preliminary discussions about possibly trying to come up with some cost-saving measures. And of course, one of the things we're talking about, again, would be to possibly combine the services into one. And we've had very preliminary discussions about this at the staff level at this point. And before we proceed further with it, we wanted to basically run it by you to see how you might feel about it. And if you're supportive of the idea, then certainly we'll continue to work on that. If you think it's a bad idea, then I'd like to know that now, and we've got other things to work on. So that's why I just bring it before you tonight, and certainly if you have any questions about that process or about the new standards, I think maybe Stanley or Don and I can probably answer for you.
I've got a question on the new standard. I mean, obviously it would be difficult if you're a county and you got 2 people with somebody supervising over those 2. If you get a couple of car wrecks, I mean, you got to stay on the line with that one person. I mean, it's kind of dicey, isn't it, Stanley? It would be very, unless you did have more than 2 or 3 people.
Well, and it happens more often than you would realize. It happens in a sequence of time frames sometimes when it's very inconvenient as far as staffing. The problem with the reason we're not currently emergency medical dispatch credentialed is because of the requirement for the number of personnel that would have to be staffed in there 24/7, 365, and the fact that they would have to continue on with that caller until that first response unit or agent actually is on that scene, which, as you say, several times there's multiple accidents going on or multiple events going on simultaneously, and we may have 3 of the best 4 personnel today, best of our time staff in there. Sometimes it can get overwhelming. So you're looking at something being mandated to create a much bigger platform of the number of personnel on duty at one time. And
Okay, thank you. Any questions from the board on this?
Yes,
Mr.
Mr.
Taylor?
Chairman. So this is a new standard, but it's not in place yet, is this correct? It's just that they're under discussion. Correct. Okay.
well, basically, what, I think it was last November, they changed one of the deals concerning 911 funds and how those monies will be spent. And they also empowered the North Carolina 911 board to adopt and create standards for which all public safety entry points had to abide by or operate by. Whereas before, they pretty much controlled the money, but they didn't control the regulatory side of it. There were standards out there, but those standards were voluntary, those standards were not mandated. So now they're tying the relationship of the public safety entry point funding along to certain guidelines. And they're marching forward at a pretty fast pace because I think that their plan has actually adopted by January of 2012, my opinion.
So we went from nothing to a salary, is that what you're saying?
No, sir, I'm not saying that. We went from, something that was being managed at the local government level to now the North Carolina 911 board dictating to you how you're going to do it.
But you're gonna have to hire a salaried employee
Two more.
to do all this. Two, you're talking about two and a supervisor, correct?
We're gonna have to add additional
No, I'm saying, but
for
just
all,
start with-
for all processes of the shift that are on duty.
And the thing is, all three entities in Craven County are gonna have to do the same thing. For example, Havelock, they have already done some estimates on what their staffing will be. Currently, they have 5 full-time dispatchers and 5 part-time, and they anticipate they're gonna need an additional 7 full-time people in order to comply with this. And that's before the EMD is implemented as well.
So an additional 7 on top of the 5.
Correct.
The funding for this, I mean, some of the equipment is paid for by the telephone tax, part of that comes back, but the salaries of the employees are all counted, right? Or city, whatever the case may be. Okay.
So do we have a breakdown about how many calls we're getting on average, or by month, or anything? I mean, I know it probably changes all the time, but I mean, is there a breakdown of how much we use these call centers? Traffic that they receive?
Yes, sir, there is. In fact, I've been working on some preparatory things for Mr. Blizzard, and it's quite astonishing to look at, by month and by type. The only problem is today, as we speak, I cannot see those numbers for Newbern and Havelock. I have put a request in to obtain some of those numbers from those agencies to see what their call rates are. It's really amazing to look at. I don't have a total number for you here tonight, but you can certainly see that anytime it's part of public information.
Mr. Blizzard, is sort of your understanding that there would be duplication of services if we keep 3 call centers?
Well, there's currently duplication of services, yes, sir. And we believe that even without these new standards, I think there's some savings that can be realized if all 3 could combine and come up with a fair and equitable means for financing a combined effort. But it's just going to be even more so with these new standards and the additional costs that it's going to cause.
What do we believe the disposition is of the other 2 communities? Are they wanting to move forward with this?
Havelock actually contacted us. I've had several conversations with the Newbern city manager in the time that he's been here about several things that might be of common interest to both the city and the county. And this has been one that we've mentioned, but again, it wasn't really put on the front burner, I think, until we started getting this information out of Raleigh about what may be coming down the pipe.
Do you anticipate that perhaps a non-affiliated arbiter, some sort of a consultant, might be brought in to assist with this effort to determine exactly what the needs might be and whether or not a an alignment of affairs could exist?
I think that would be wise. In fact, later this week, the managers plan to meet to discuss this further, and I think that's going to be a topic. We're going to see if we can find out if there's some people out there, what kind of money we're talking about, and just possibly come back to this board and their respective boards as well to discuss that possibility.
Commissioner Sam?
Yeah, well, we tried this in the past and looked like we couldn't get cities and counties to work together, but now at hard times, I believe we have a better chance of accomplishing this. If we try to do it alone, I believe we're gonna get in trouble with all the money we're gonna have to spend to maintain the one that we have. But doing it together, I know it would be a lot cheaper if we could work and do it together.
Okay. Mr. Manager, I think what we're hearing is that we would like you to proceed with talks with the city of Havelock and the city of New Bern to see if consolidating the 911 call centers could be beneficial to all the entities. We look forward to a report from you in 2 weeks.
Yes, sir. Well, I'm going to get 2 weeks as soon as I can. Yes, sir. I might add too, this is not all about money either. We're hoping too that this will actually improve coordination among the different agencies and better communications as well. So this is just a plus, I think, if we can get this to work.
Okay.
All right.
Is that the desire of the board? Any objection to that?
No.
Okay. All right. Proceed, Mr. Manager.
Thank you. I have just a couple other things I may mention to you, Mr. Chairman.